Dan Le Batard.
If you see a photo of fries, do you reach for it, not unlike a pigeon flying into a sliding glass door?
I'm not kidding you. That I have been tempted in restaurants just walking past tables to grab somebody's fries. That hasn't happened to you guys?
I've done it.
You've done it to me.
Have you done that thing on like actual photographs where you try to zoom in on it with your fingers and you just make a big streak across it?
A bigger fry? Yes, I've licked my computer screen when it's on there. I love French fries.
Stugatz.
Who doesn't love French fries? I thought
there's
that was
always someone out there.
I thought that was the one thing America could agree on. I thought that was the one place where every citizen in our country would indeed be united across the 50 states.
This is the Dan Le Batard Show with the Stugatz on ESPN Radio.
ESPN Radio is presented by Progressive Insurance. Dr. Celine Gounder going to join us, expected to join us here in just a minute on the Shell Pennzoil Performance Line. Get an update on the coronavirus. Here's your SportsCenter update. WWE announced that WrestleMania will take place over 2 nights, April 4th and 5th, and will be hosted by Rob Gronkowski. The ATP and WTA have jointly announced that the suspension of play on both tours has been extended to June 7th, a decision that eliminates the entire clay court swing through Europe. And finally, phobophobia is a fear of phobias. Vivid Seats is the top ticket source for the live events you crave. They now have a loyalty program that allows fans to earn credit back. Go to the App Store or Google Play, download the Vivid Seats app, and enter promo code ESPN25 for 10% off your next order. For all the latest headlines and information, tune in to SportsCenter on ESPN Radio all throughout the day.
So she's known as the disease detective. She's a clinical professor of medicine and infectious diseases at New York University. Let's see if we get informed here a little bit. Dr. Celine Gounder with us on ESPN Radio. Thank you for joining us. She was also voted by People Magazine 25 Women Changing the World. Thank you again, as I said, for joining us. Can you explain to us on the front end what are the biggest misconceptions about the coronavirus?
Well, I think there's some people who are still not taking seriously the severity of this pandemic. We have not seen anything like this since the 1918 Spanish flu. There seems to be the impression that, one, this is no worse than the seasonal flu. That is not true. We're looking at hundreds of thousands of people across the country dying in the coming year, and that's no small thing. We're already seeing health systems, hospitals, and so on overwhelmed by patients already presenting for care. And this is a war, and we're sending our healthcare workers off to the front lines without armor, without the appropriate protections, while, frankly, there are people out in the community still hoarding personal protective equipment that they need. It would be like hoarding bulletproof vests and bullets during a war instead of giving them to your soldiers because you wanted to protect yourself. It makes no sense. And unfortunately, people really need to start pitching in and doing their part. And that means, one, acknowledging this is real, two, really adhering to the social distancing measures, and three, if they have personal protective equipment at home, reaching out to their local public officials to see how they can make a donation of those items safely to the folks on the front lines who need them.
Without being alarmist, can you explain to us the reasons beyond the ones you just gave us that there is a great concern, because you are more informed than the average person by a great deal on this? Like, the parts of this that are most alarming to you are blank.
I think that young people in particular, but really, of all ages, do not seem to understand why it is so important to do the social distancing. None of us is invulnerable to this, regardless of your age. Yes, we're seeing the most deaths among people 70s plus, but we're also seeing people in their 20s, 30s, and 40s who are critically ill, who need to be on a ventilator, and that's no small thing. Being on a ventilator, you can end up with permanent damage to your lungs down the line, with scarring of the lungs. You can have brain damage from decreased oxygen to the brain. And a lot of people who end up on a ventilator have long-term issues with PTSD from the experience. This is not a minor thing. So this is something to be taken very seriously. The other thing is this is causing collapse of our health system. So it's not just about people with coronavirus. It's everything else. So if we are completely overrun with patients with coronavirus, we can't take care of all the patients who have everything from appendicitis to a stroke. And so this is really, we really are at war with this right now.
Doctor, you seem very frustrated, and understandably so, because there's a lot of people, there's supplies that doctors need that are trying to help patients. There are people who are not taking this thing seriously. What has been the biggest challenge for you and other doctors out there? What's frustrated you the most?
Well, I am really scared for my coworkers. I have a coworker this morning who texted me. She is pregnant. She's, I guess, about 6 months pregnant, and she's being asked to come into the hospital to work because they are so short-staffed. And we don't know still exactly what the risks are to pregnant women, to their unborn children. And not to mention the fact that she's also at one of the many hospitals now across the country where we're seeing shortages of personal protective equipment, where we're out of those N95 respirators. Doctors are being told, nurses are being told to use those loose-fitting surgical masks, which is not what you're supposed to use in this situation. We use those masks to put on the patient so that they don't spread to other people. It works differently. And then most recently, I saw the CDC is now recommending, well, if you run out of masks, why don't you doctors and nurses wear a bandana or scarf? I mean, that is just, I can't even tell you how scary that is for those of us in the hospital. And it's only potentially adding to the problem, because if one of us is taken out sick, well, you've added to the patient load, but then you've also taken out somebody who would be caring for those patients. So you're sort of shooting yourself in the foot twice by doing that.
Where are we in terms of the way other countries are handling this versus the way that we've been slow to test? Like, when you see the comparisons with other countries, how bad has the United States been comparatively?
We're one of the worst, quite frankly. For a world superpower, this is shameful. We are not living up to what our potential is by any means, whether it's from a can-do, let's do this together, band together and conquer this thing perspective, or from, more of the logistics and putting to work the science perspective. We are really behind countries like China, Singapore, South Korea, and sadly, many people are going to die as a result of that failure.
Where do you see hope?
I do see hope. If I look through my Facebook feed this morning, I was looking through and it was full of pictures. Sorry. It was full of pictures of my friends from school, from residency, who are all, who are all gowning up and gloving up to the degree that they can, but really underprotected. And I'm just terrified for them. And look, I have worked in other places. I've been on the front lines working as an Ebola aid worker in West Africa. We were never asked as aid workers to go in this unprotected and unprepared. I take hope in the fact that my colleagues are so committed and that we're there for each other.
Doctor, I'm sorry. Let's allow her to regroup. Can we have you back for another segment, please? I'd like to get some more information from you and let you gather yourself. Would you be willing to come back for another segment, please?
Sure.
All right. I don't think the timing is very good on doing a sponsorship here. We will make it up to the sponsor in a moment. We come back with the disease detective, Dr. Celine Gautam.
This is the Dan Le Batard Show with the Stugats on ESPN Radio.
If you missed any of the show, you can listen to all 3 hours of the Dan Levitard Show, plus our Miami Only Hour and our Best of Podcast on demand in the ESPN app. And subscribe to the Levitard and Friends Podcast Network featuring South Beach Sessions, Stupidity, and Mystery Crate. Please rate and subscribe. New episodes are posted every week wherever you get your podcasts.
Super jarring and scary to have someone on who's a lot more informed than we are, who has a lot more facts than we do, and to ask her about hope and to get that heartbreaking response. So we're grateful to Dr. Celine Gounder for joining us here again on ESPN Radio, clinical professor of medicine and infectious diseases at New York University. Can you explain to us what is out there so far that you are viewing as fiction, as total fiction, that people need to understand the facts around this and they're getting some fiction?
I think number one, this is real. I think number two, the coronavirus is not the seasonal flu. This is far more deadly. Seasonal flu kills about maybe 50, 60,000 people across the United States per year. That's no small number. But with this, we're looking at hundreds of thousands, if not millions of Americans dying in the coming year. And it's not just people who are elderly. Yes, the highest mortality rates, death rates are among people 70s, 80s, and plus, but we are seeing young people in their 20s, 30s, 40s dying from this. We are seeing them end up on ventilators. And not to mention that young people can also be transmitters of infection, even if they don't get very sick. So I find that profoundly concerning. We're also now realizing that in the youngest, kids under 5, the mortality rate and severe disease rate is not negligible either. We hadn't fully comprehended that before, but now in looking at the data from China and elsewhere, we're realizing little kids are also at risk. And so, especially for those of us, and this is common with infectious diseases and viral infections, that those of us who are young adults are the ones who are the least affected in some ways, but we don't live in a vacuum. We have little brothers and sisters, we have children, we have parents and grandparents, and this affects all of us that way. Not to mention the fact that I know many people are concerned about the economy. They're concerned about their jobs, their livelihood. Are they going to be able to make rent? But none of that is going to get fixed so long as we're in this public health crisis. That the crisis needs to be addressed first, and people need to be given a bridge to the end of that. So working families do need help, but the economy in bigger picture terms really isn't going to recover until we get over and through this crisis. And so we need to be focused on doing that.
What would you say is your most optimistic projection for when this will end? Because I'm now beginning to read stuff where you're talking about 18 months and it can come back. It's not going to be something that just disappears. Your most optimistic projections here are what?
I think that if we can really commit to real social distancing, and by that I mean, if you're a family that has, for those of us who are more privileged, a housekeeper or a nanny, unless they're going to stay with you all the time and live with you, you really need to think about your family unit as a bubble. No one goes in or out, period. And we need to start viewing it in those terms, with the exception of really essential runs to the grocery store and, those very essential things. We should be staying at home as a family unit. If we do that, I think we have a decent chance, maybe over 5 months, of curbing this to the degree that we can loosen some of those restrictions, those interventions a bit. That said, we are still looking at a longer period of time. We probably will see waves of this where you'll have to reinstitute measures for a period and then loosen. And then once you see an increase in cases, reinstitute. So you're going to see a sort of wave of that after the initial period of really strict measures. I think looking to China will be very informative because they're in the midst of essentially loosening up after a period of very strict measures, far stricter than we will ever accomplish. So I think it'll be instructive, but at the same time, I would anticipate for us, we're going to have to maintain restrictions for longer because we're not doing so as rigorously.
we're just getting started with this, and it sounds like from what you're saying that our healthcare system is already overwhelmed.
Yep, it's already overwhelmed. I have friends who are surgeons who are not doing surgery anymore. They're pitching in on the medicine wards to help us out. There's all kinds of stuff like that that's happening. The regular health system is falling apart already.
And you think how much worse is this about to get, even if we apply the measures in the strictest possible way and somehow get better at this than we've been?
I think the next 2 months, you're going to see exactly what we saw coming from hospitals in Wuhan and what we've seen from Italy. I think it's going to be the same thing, maybe even worse.
Dr. Celine Gounder with us here on ESPN Radio. She's a clinical professor of medicine and infectious diseases at New York University. If you're telling people that they need to know these handful of things, I know you must find appalling as you're watching these television video clips of Florida spring breakers saying, hey, I got to keep partying here. But the most important things that people need to know now, the most important facts that people need to know now are what?
I mean, the basic stuff of washing your hands still applies, but I would say stay home. If you're not a healthcare worker or doing some other absolutely essential service like that, stay home. And really, there are other ways to celebrate with your friends, to support one another. I have friends, and unfortunately I haven't had the time to join in because I've been so swamped with everything related to this, but I have friends who are having happy hour, over Zoom a couple times a week. There's so many, we're fortunate actually, given the time we live in, to have those kinds of things that we can do, the way that technology can still help us remain connected. That was not the case during the 1918 Spanish flu. So in some respects, yes, it's social distancing. I would think of it as physical distancing, not necessarily that you have to lose your relationships with other people.
Doc, people are so confused as to what they can and cannot do in terms of going outside. So I know you're saying stay inside, but are there a few circumstances where you're saying, hey, it's okay to go outside, maybe exercise if there's an emergency? I know you're saying do your best to stay inside, but I think a lot of people are confused as to how long they can go outside and how often they can go outside.
Yeah, I wouldn't think of it so much as how often and how long. I would think of it, you're traveling in your bubble, right? So
Yep.
You have a bubble that is at least 6 feet, 2 meters, 2 yards in diameter. A sphere, think of it as a sphere you're building around yourself. And again, you should not be coming closer to anybody than that. So if you want to go for a run, you want to go biking, as long as you maintain that distance from other people, I think that's okay and that makes sense. However, from the photos I was seeing, images I was seeing from San Francisco, for example, where they have instituted shelter-in-place regulations, that is not what we're seeing, and that's concerning.
Can you help me understand the very basic ways for all the social distancing? For example, if I go to a grocery store and I put my debit card in a place where everyone else has had their fingers, that's a risk, is it not?
It is. I think, there's some things that we just cannot get around. However, if you are fortunate enough to live in a place where you can order your groceries online and do a curbside pickup, have them delivered to you and have somebody leave them at the door for you. We're fortunate that those options even exist today. Those are the kinds of things we can do to keep our distance and still do what's necessary to get by during this period.
Have you ever been this scared?
No.
Okay. Doctor, we appreciate your time. We appreciate the information. Thank you for making the time.
Well, thank you for letting me talk about this on your show. I appreciate that.
Thank you,
Okay.
Doctor.
We'll probably have to check back in with her if she has time in order to keep getting more information on this. Our thanks to Dr. Celine Gounder, again, clinical professor of medicine and infectious diseases at New York University. Apologies for the awkwardness of this, but as we've told you, we are grateful that our sponsors have stuck with us during a difficult economic time. And Advance Auto Parts, even though you should stay at home here, she's telling you, you need to be staying at home. Advance Auto Parts, when we can go back out, Advance Auto Parts will help you with your vehicle care. Stugatz, explain to them why they need to be partaking in Advance Auto Parts.
Yep, you may not be able to run, throw, or catch like a professional athlete, but now that it's spring, you can get your lawn looking like a professional sports field, assuming your lawn gear.
Other way to segue from what really was a scary, and if you weren't scared.
Oh, I was just talking about that trips I've ever been on.
We were afraid his bad vibes might follow us to our wedding day, so we left. For the right reason is
the very same thing one of two ways. You could get it honestly or you could steal it. He'll always choose stealing it.
Stugatz.
Well, it's the quicker path. I mean, it's just,
This is the Dan Le Batard Show with the Stugatz on ESPN Radio.
Today on ESPN Daily, U.S. soccer is under fire. Its president resigned after controversial legal arguments against the U.S. women's team. World Cup and Olympic champion Julie Foudy takes us inside the backlash. Presented by ADT. Download, subscribe, and review ESPN Daily, available wherever you enjoy your podcast.
Not that we didn't know here more and more every day that we are surrounded by idiots, but I rarely get infuriated by something that is happening around our show. I know that what we do here is stupid and silly. I know that it doesn't matter, that everything that we're doing around here is largely an escape hatch on serious issues. But the way that some of you are reacting to that doctor interview has me legitimately mad because of how idiotic you are about your reaction to someone who is clearly more informed than we are. I asked the woman about where she saw hope. There was an interminable pause, and then she started sobbing. And the idea that many of you want to reject science and want to dismiss her as emotional because it simply is easier to not fear than to grab facts from someone who knows a great deal more than you do. Like, it is legitimately something that I want to end the show right now and be done with our today, because I know that the sports realm is filled with a brutal stupidity all the time. But the idea that you would react to that doctor with, like, you don't have to be afraid if you don't want to be afraid, and you can be cynical and say this is all an overreaction and everything else. But when someone who's actually on the front lines, someone who is actually informed more than just about anyone listening to this right now, tells you that there are very grave reasons for fear, and you comfort yourself by simply rejecting her and being a stupid person, it is something that makes me legitimately angry in a way that I am rarely legitimately angry around here. So let's finish up what we're doing at Le Batard Show. Go ahead, Stugatz.
I think we have a tone violation, $2, Dan.
That's fine. That's fine. I'll take the tone violation, and I'll tell everyone to go bleep themselves. Go ahead. Finish up with the polls.
Another
that's
$2.
fine. You know what? Go bleep yourself again. I'll pay all the fines. That's fine. Just whip-de-damn-do a blank check here of fines. Everyone go bleep yourselves. At Le Batard Show, if you want to do the Twitter polls. Go ahead, Stugatz.
Do you know what a Roomba is? Is that the vacuum that you have in your house that is just like is it a robotic vacuum? Is that what it is?
Yes.
Okay, wow. 93.6% of the audience said yes, they know what it is. Are you addicted to the internet? 90% of the audience said yes. Does your life fall apart when your Wi-Fi does? 85% of the audience said yes. Does Tyra Banks' model theme park, Model Land, sound like a good idea? 81% of the audience said no. Those are the polls today, Dano.
Billy, are you ready to do some Music Dome here? Because I want to put down my headset and be done for the day. So if you want to do the Music Dome update, are you ready to do this? I know I didn't give you any warning. What's that, Mike?
Why do you want to put down your headsets? That's such a great segment.
Yeah.
Rude.
Right. It's weird.
Okay. Yeah. I just told you why I want to. I want to throw my headsets right now at the computer screen and be done with the show today. Go ahead, Billy. Music Dome. With that kind of intro, how can you not be excited about reviewing The Masked Singer?
$1 million.
Thanks, Dan. So yesterday was